Hello student, I'm so sorry I can face to meet you because the domestic situation. But I think it's also we try to give that lesson that you know the basic surgical instrument. And today the class will introduce some very basic surgical instrument. And then surgical instrument for the doctor, for the surgeon, just like gun to the soldier. Before you join the fighting, the soldier should know the weapon very well. So it means the doctor, the surgeon, when you will go to the operation room or operation theater, you should know the instrument very well. The first instrument we call the surgical knife, scalpel. There are two parts. This one we call the blade. This for the use only one time for one patient. The surgical operation is teamwork. The operator, assistants, the nurse and non-nurse will make a group. So before the operation starts, the assistant must to replace the blade to this we call scalpel holder and surgical knife holder. Maybe called surgical knife holder. And before the operation start, assistant use this instrument. Later on, I will tell you what is the name is. Is the blood hemostatic clamp. On this one, we call the needle holder. So we will use this clamp on this needle holder to hold the blood like this. Hold the sharp end, clamp like this. You can hear the crack, and the blade will replay inside it, like this. Before you are doing this, always the blade should sharp margin should away from your body, not like this. Should put it like this. After the operation, the assistant should remove the blade and use the needle holder or hemostatic clamp here. Clamp the other end of the blade and lift up a little bit and push or take out the blade. Let me show once more. This is the needle holder. Now I use the clamp, the same. Clamp the blade and the sharp margin far away from your body. It's outside your body. It's not like this. Just in case broken the blade, the sharp margin will cut your body. Yeah. So I do it again. After the operation, and clamp this, lift out a bit and push to take off the blade. And now, this we call surgical knife, scalpel. How to use the surgical knife? There are 4 types of holding. First one we call pen holding. The style of pen holding. The pen is just like you're holding the pen on the pencil and hold like this. The knife holder, there are some mark here. So use the finger, put on the mark. Use like this. This style is most of our operations would use this style. And second one we call bone holding. Holding bowl like a violin, play the violin, the bowl. So with index finger place here and use thumb and the middle and forefinger use like this. And the third type of we use all arm, all the palm, hold the holder, we cut like this. It means for cut hard wood tissues like the bone, we will use this one. And the third one, the same use the holding pen, but sharp margin is up. We call the opposite style, opposite poke. When the operation, we cut inside the incision, putting the knife inside the incision, and from inside to come outside. Cut like this. There are 4 styles holding the surgical knife, surgical scalpel. Okay, this is the first instrument. The second instrument, this one, it's a big one. There are round ring here. We call Sponge Forcep. This just for holding the cotton for the for sterilize, not just for sterilize, for use this clamp. The third one, I like to introduce the scissor first. How to use the surgical scissors. This scissor, there are main 2 kinds. Can you see that? This is straight. This is curved one. The blade is curved one. It's called suture scissors. This is called tissue scissors. It means only can cut the tissues. And how to hold the surgical scissors? For the hair cutter, they use the thumb, putting 1 ring, and use the middle finger, putting another ring like this. This we call style is for hair cutter, barber. If you want to be a surgeon, we should do the different. Same thumbs, put in the 1 ring. And the next rings, we put in the 4th is the ring finger, put it here. And rest the middle finger in front of this ring. And index finger can place like this. Scissors holding like this. And we can cut from far, close here, or up, the arm up. From near the body, cut to the far. And can cut from this way, and can cut like this way. And maybe some need, we cut different from here, but they are very rare to use. For a student, I think you just know how to hold like this. And remember, this one only can cut the suture on dressing. And this one is cut the tissues. Never use tissue scissors to cut the suture on dressing. That will damage the scissors. And most of the time, scissors, we don't open like this. Open the mouth, don't open the too big. Most of the time, we only use the end of the scissors. Open a little bit. Why we don't open the scissors like this, very big? If you open the scissors too big, when you close, but the end may be cut to the other tissues, maybe like a liver, intestine. So at the same time, you cut the sutures and will cut the other tissues. will damage other tissues. Maybe the nerve, and maybe the blood vessel. Yeah. So all the time we holding the scissors small bit like this. When you close the scissor, be careful. Should make you see the end of the scissors very clearly, and then you can close. And straight one, we call the suture scissors. We can usually do in the shallow, and the curved one, the tissues operate in the deep incision, deep part, because it's curved one, so we can see the end of the sutures pretty clear. Yeah. Now I introduce this one, hemostatic clamp. Hemostatic clamp. There are also the main two kinds. Straight hemostatic clamp. This one is curved one. Why need straight one and a curved one? The same with the scissors I taught you, because shallow one we use this straight. Then called hemostatic clamp. Main function is stop the blood bleeding. So we needed to clamp blood vessel like this. Huh? So when in the deep spaces, we needed to use the curved one. So the same with the scissors, because the curve, we can see the end of this instrument. If we use the straight one, our hand will cover our vision, so we can't see the end of the hemostatic clamp. And see, hemostatic, the head is the straight and the curved one. And here you see that different from the surgical knife. They also have two ring here, but they here have some key here. How to use the hemostatic clamp? The same with the scissor. Putting the one lumps to one rings and the ring finger to the other rings. When you clamp the tissue in the blood vessel, you can hear there are 4 keys here. Usually we use 2 keys. So you close, you will hear the sound click 2 times like this. This was close the hemostatic clamp. If a small one, hemostatic clamp, we also sometimes call it mosquito clamp. And when you close this clamp, how to release the key from here? There are 2 styles. One is right hand. You put in the thumb and the forefinger. When you want to release, you need to close a little bit and thumb finger to push forward and release. Close, push, and release. This is right hand style. And left hand style should like this. Use the thumb and the index finger hold one ring, and the middle finger and the forefinger go to the other ring, and also need to close a little bit and push opposite and open the clamp. And the fourth instrument, needle. Sometimes we also use the straight needle, like we are family use the needle straight one, and that we can use the finger to hold the needle to stitch, like a normal stitch at your home to close your clothes. The same. But most of times we would use this one, these kinds of needle, circle one, and sometimes it's half circle and a 2/3 circle are different. And this circle, the suture, the body, they have a round body like this. This one. The body is a round one. Yeah, this is a round one. The other kind, this main, the body triangle, right, like this, 三角形. This for the suture skin, and round body is for the tissue. The needle holder. Use the needle holder to hold the needle. Try to use the holder, the end of the holder. And the needle, we clamp 1/3 part near the front end of the needle, like this. Like this. And hold it, the needle holder, the same with the clamp and the scissors. Use, I'm putting the 1 ring and the 4 finger in the other rings, and like this. The other holding style can, this 4 finger is in the 1 ring, and the other rings not putting the finger, can left this ring in the arm like this. Sometimes we maybe holder in one hand, not putting the finger. Not putting finger. Sometimes very rare to use that style. And then you should know this one. Putting the 2 finger to use the needle holder to clamp the needle. And after clamp the needle, hold style and put in the suture. Usually this one's longer for 15 centimeters. Put in the suture like this. And the short one is 1/3 part. And this 2/3 parts is the longer one. After putting the suture and rest suture between the needle holder, to make the suture not easy to lose out. If you don't put in there, when you move, the suture will go out very easy. So after putting the suture, we rest the suture between the end of the holder. And I talk surgical work is a teamwork. This putting the clamp the needle and putting the suture is the job of the nurse or assistant. And how to pass this instrument to the operator. The same, the knife, how to pass the knife to the operator. 你站在这里一下。